I do not have health insurance, and I have no plan on ever getting health insurance again. I'm 52 years old. Basically, I have reconciled that if I am going to sicken and DIE of something, then so be it.
There's no health care for us.
Y'all, I just did the math, and why is it cheaper for me to not have health insurance than it is for me to have health insurance?
As a Canadian who's been living in the USA for a number of years, the healthcare here was the biggest shock to get used to. So as you know, in Canada, we have universal healthcare, and in the US, obviously, we do not.
I'm an American. I pay $1,600 for a flat that has no bedroom. That's 2/3 of my income. I'm an American. I work 50 hours a week. I don't have health insurance. I'm an American. I couldn't afford to have a child even if I wanted to. I'm $7,000 in debt. I'm an American. My health is declining because I can't afford Whole Foods because that's too expensive for my life. I am very overqualified for my job, but no one else is hiring. I'm an American. I make my boss hundreds of thousands, if not millions of dollars, while I can barely keep myself alive.
Hello everybody, welcome to my channel. Baby, I have to share some of these videos with you. A lot of our fellow Americans are in absolute shock now that their health care, their health insurance, their premiums have doubled and tripled. Now, people said this would happen because of Donald Trump and the big beautiful bill, and it's happening. A lot of people are saying the hell with it. Americans are giving up their health insurance. This has been happening for a while, but more people are saying no, absolutely not. The rent is crazy, inflation, the food crisis, the SNAP EBT issue, and it's just too much. A lot of people said this is crazy. We should have universal health care. Everyone should be able to see a doctor. And I can't deal with these bills anymore. I'm not paying $400, $800, $1,000+ a month. No, absolutely not. And some people are moving out of the country. Some people are going to remedies and herbal medicine, or just saying, look, if it's my time to go, baby, it's just my time to go. If I just have to drop, you know what, from this sickness, oh well, because I'm not going through this. I'll just leave my faith in God, in the Lord, and see if I get healed or not. But I'm not paying all this money. The health insurance, this is all a scam. And a growing number of Americans don't have health insurance. Some don't want this to be the case, and others by choice. And now recently that their premiums have doubled and tripled, a lot are saying, look, unfortunately, a lot of us are just going to have to give up having health insurance. And I'm going to share with you near the end of this video people giving tips on how they survive, how do they go to the doctor still and get their medications, or pay out of pocket, or have a low cost, all this stuff. So it's getting really real. And look, we already know what's going to happen. Okay. A lot of people said, absolutely not. This is insanity. What is happening to our country? This makes no sense. We should all be able to see a doctor. Now, with the state of our country, you're doubling and tripling how much you want us to pay for health insurance. Some people don't even get sick that much. So a lot of them said, look, we're giving it up. We are giving up our health insurance. Now, you do need car insurance. Some people even choose not to have that. So let's get into it. Let me show you what is going on.
All right, it's the day that all our healthcare insurance premiums go up. How much did yours go up? Mine went up $230 a month. I don't think I could pay that. I might be having to go without health insurance. This is insane. I cannot believe we live in the richest country in the world and we can't have healthcare. Millions of people are going to lose their healthcare because of this. So I want to know, how much did your premiums go up? Are you willing to pay that? And how do you feel about this whole situation? I feel just defeated, just so angry. You know, ever since I've been paying my own health insurance since the age of 26, it's only gotten more and more expensive, and less things have been covered, to the point where I'm literally moving to an entirely new country because that is the only way I can get health care. It's unbelievable. It's just absolutely insane to me that we cannot figure out a system in this country that works for its citizens. I'm just at a loss for words, honestly, at this point.
This is so dead serious. I've never been more serious. I'm trying not to laugh just because it's so serious, but the talk is never cheap. Everybody who's 25 plus, everybody who's about to be kicked off of their parents' insurance any day now, there's no more healthcare. Anybody who's going to turn 25 during Trump's presidency, there's no healthcare for you. And if there is healthcare for you, you're going to be paying half of a rent payment for it. You're going to be paying $700 a month, if not every 2 weeks for it. Because they're tripling the health insurance next month. Mind you, the health insurance is already high. They're tripling the health insurance next month, and there's no Medicaid. So if you don't work for a company, a corporate job, or if you're not married to somebody who works for both, there's no Medicaid. There's no health care for us. There's no doctor, there's no dentist, there's no gyno. Oh my God, I'm about to cry.
Okay, so this is very serious, and I do have some videos near the end of this video with tips on how you can go to the doctor. I might have a part 2 or 3 where I will show you more things you can do. Let's see a little bit more.
Healthcare without insurance. It's becoming a trend, not just because of the political climate, but people are willfully choosing in their households not to carry health insurance because it's too damn expensive. I even have a patient where the husband and she are professionals and contractors, and they've chosen not to do it. Now, how do you go about this? Well, there's a lot of different ways. Of course, there are different telemed platforms, and you can get all kinds of care ethically and properly. You can go to some of the retail clinics. You will see CVS and Walgreens have urgent cares that are cash pay. And to that point, a lot of hospital-based urgent cares do have cash options. There are some free county-based clinics. There's also a lot of direct care or direct primary care where the cash cost many times is even lower than what your co-pays would have been with traditional insurances. I might also suggest some of the university and teaching hospitals have some free clinics as well. Now, some of the telemed platforms and private platforms or functional med platforms, while the cash may seem a little bit more upfront, maybe per visit, a lot of times it is so directed and so individualized and teaches the independence that you need rare visits to be able to take care of yourself.
Every time I tell somebody that I don't have health insurance, I get this reaction. What do you do? What are you going to do? I go to the doctor if I need to, and I pay out of pocket. It would cost me $1,200 a month out of my paycheck to put my family of 5 on a health insurance plan through my job. And as somebody who's not very sickly and doesn't have a very sickly family, I really just can't imagine giving $1,200 a month to an insurance company who's going to turn around and tell me what they are and are not going to pay for, and then they're still going to make me pay a copay when I go to the doctor's office. And by the way, the copays that y'all pay is pretty much what I pay cash out of pocket when I go. So I have this grand idea that if we all did not sign up for insurance and instead take that money that you would spend to your insurance company every month and put it into a savings account that is strictly just for your medical things, then you get to decide what you pay for medically, and you don't have somebody else telling you who has your money that you paid saying, oh, we're not going to pay for that. We don't think it's necessary. I know that may not be ideal for everybody and everybody's situation, and there are situations where insurance is a good thing and it really does help, especially state-funded insurances for people that are in, tragic situations or need like a lot of long-term care, or families with special needs, children, and I get that. So I know it's not for everybody, but also everybody doesn't necessarily need insurance. In my opinion, I'm fine. And if something bad happens and I get into a car wreck, they're not going to take me up in there and be like, well, I see you got 2 broken legs and you're bleeding from your right lung, but we got to send this one home because she don't have health insurance. Guess what? They're still going to treat me. And then I'm just going to pay, the minimum monthly payment on my bill if I need to do that until I get it paid off. Or, maybe I'll save up what I would pay to my insurance company and I'll pay it towards that hospital bill. I mean, That's what makes the most sense to me. If you really think about it, why would I pay an insurance company $1,200 a month? And then I'm still going to have to go to the hospital and they're going to overcharge my insurance company. But then I'm going to also have to come out of pocket, I don't know, maybe another $1,200 to the hospital. And it's a scam, guys. It just doesn't make any sense to me. And that's how I choose to live my life. Don't judge me for that.
So I don't normally jump on that health insurance is a scam, but today it is absolutely a scam and I swear it's fraud. I need an MRI on my back because I hurt my back. My clinic sent it over to a hospital. They ran it through my insurance. They called me and said, hey, your portion of it that you're going to have to pay after insurance is $5,100 for this MRI. So I'm like, wow, okay. I was like, before we do that, like, just wait, because I'm like, $5,100 just seems wild. I called another place who was also waiting for my insurance to go through to see how much it was going to be. My insurance was still on hold with them, but I asked them, hey, if I just cash pay this, how much is it going to cost for this MRI? And they're like, well, if you just want to cash pay it, not run anything through insurance, it's $700. And so I'm like, sounds a lot better than $5,100. So I called the original hospital back and said, hey, if I don't run this through insurance, what is the cost if I just decide to self-pay it, since I know the other place is $700? The lady's like, I'll rerun it under you being self-pay and I'll call you back with your total. So a few minutes go by, the lady calls me back and she goes, hey, I talked to my supervisor. Since you have insurance, we are not going to let you self-pay it, so we won't give you that number. How is that not a scam? Isn't it my choice if I want to self-pay something versus running it through my insurance? How I should get to decide that, not you, but they're like, nope, since you have insurance and you've already done it that way, we are not going to allow you to self-pay it. And I think that's because they probably were going to give me a self-pay price, kind of like the other place, maybe a $700, maybe up to $1,300, still way less than $5,100 that it was going to make me pay. And I just think, like, what if, somebody wouldn't, like, what if I wouldn't have called around? I would have been stuck with this $5,100 bill. Insurance is such a ripoff. I don't know how in the world this hospital is telling me that I now can't self-pay it. What does it matter? I'm going to go to the other place, but I don't know how this hospital is allowed to now tell me, hey, yeah, you can't self-pay something if you have already had us run it through your insurance. I haven't even had it yet.
Our healthcare system might be collapsing, so if you have any preventative care procedures that you need to get done, I suggest doing them before the turn of the year. So this is going to be things like mammograms, colonoscopies, regular checkups, and even routine vaccinations. The Affordable Care Act conversation related to the shutdown right now highlights the need for this type of proactive approach to healthcare in this country. Because even if those healthcare subsidies are extended, we're running against the backdrop of RFK's CDC and things like vaccines potentially no longer being recommended. And that's really scary for those of you who understand science and want to be proactive about protecting your own health. It's possible that things like colonoscopies and mammograms and vaccines might no longer be covered under regular insurance if the Republicans in the White House have their way and they continue to erode the Affordable Care Act. So share this with your friends and family who are proactive about taking care of their health so that they can get those appointments in before the turn of the year when a lot of people's insurance resets. And when your insurance policy changes over, make sure you're reading the fine print, because one of the things that has been in the sights of the GOP since the very beginning of the Affordable Care Act is the pre-existing condition exemption. So if you've ever had a history of chronic illness, and this can be anything from asthma to cancer, right? So it's not just big stuff, it's everything along the way. Even anxiety could be considered a pre-existing condition. So look carefully at your insurance plan, make sure the things that you think are covered, and proceed.
Listen, baby, y'all better listen to this woman, because a lot of things that we see happening, it would be smart to get everything done. Go to the dentist, go to your primary care doctor, go to the OBGYN, go to the clinic, whatever you need that you can get done while you can afford it, do it. All right, so a lot of people are upset with how much it costs to go to the doctor and are choosing, again, not to have health insurance. This woman right here is going to tell you how much she had to pay just to go to the hospital. How much it costs? And I'm going to share some comments under this video with people talking about how much they pay and things they do to not have to pay such a high bill. So let's see. She says she spent 38 hours in the hospital, uninsured, and how much the bill came up to.
I spent 38 hours in a hospital without health insurance, and I'm going to show you how much it cost. Let me start off by saying I did have health insurance, but I turned 26 in July and was kicked off my mom's health insurance, and something rare happened to me on August 23rd that required me to go to the hospital. So let's go ahead and look at the damage. For my CT scan, it cost $4,458. Emergency room was $5,378. IV therapy, $5,097. Lab, $2,351. Other diagnostic services, $2,244. Other imaging services, $1,639. Pharmacy, $1,007. Radiology, $794. Treatment observation room, $5,907. That came up to $28,875. But I'm not finished. Emergency evaluation and management was $1,796. Bill from Sonoran Radiology was $3,552. So all in all, it comes out to $34,223. But because I didn't have insurance, they actually gave me a fat discount. So what I'm actually responsible for is $7,210. So what is the moral of the story? Do not go to the hospital in the US of A.
And there's a lot of people, people from other countries saying, oh my goodness, I'm so happy I'm not in America. We have universal health care. We can go to the doctor. A number of Americans saying they want to leave America and that it just keeps getting harder and harder and harder just to live, and that everyone should be able to see a doctor, and how this is a scam, charging that much. Okay, so let me read some comments from under this video. Okay, so let's get into these comments. Someone said, look, just don't pay for it. Nothing will happen. Then someone said, no, if you don't pay this, your credit will tank, and the federal court, they rule that it will show up on your credit report if you don't pay that bill. Okay. Someone else said, look, you need to call and ask for an itemized bill, and they will drop it a ton, the bill. Someone said, I don't think you got the physician bill yet. There are two types of bills, the hospital bill, and then there's the physician bill. All right, let's see. Well, let me move this down. Someone said, look, just tell them you'll set a payment plan of $1 a month forever, and they'll drop that ridiculous bill down to about, $1,500. Okay, someone said, look, I guarantee you that they will take the lump sum. As long as you're paying something, they can't send it to collections. Even if they send it to the collections, okay, something. But basically, this person is saying just get a $1 payment plan a month. Someone said, look, I told a hospital I'd make these payments, and they said they don't care. We'll still send it to collections if you don't pay it in full. It was in the thousands, and I laughed and said, look, I'm sending $1 in. They said, oh, well, and all right. Someone else said, the same person who said send $1 in for your payment plan said, I'm a chiropractor, and this is why I let my patients know up front exactly to the penny how much things will cost. Nobody should be surprised and get a bill for thousands of dollars. It's ridiculous. Then someone said, but they can send you to collections. Trump and the GOP changed the law back to your unpaid medical bills. They can still be reported and downgrade your credit. Okay, so I'm seeing a lot of different things. Someone said, I'll be filing for bankruptcy immediately. I don't think you can file bankruptcy for medical bills. You absolutely can file for bankruptcy, just not for child support and owed taxes. Someone else said, moral of the story, I'm getting rid of my doggone health insurance. Ask for an itemized bill. I promise you the price will be different than what they billed you. This happened to me, and I asked for an itemized bill, and it was a $2,000 difference. I had 2 ER stays in May and June. My bill was $13,500, and I asked if they had a financial aid program, and I got mine completely covered by applying for this. Okay, so these were a few things that people were saying, how they were able to lower their medical bill. Again, one person said, have a payment plan of $1 a month. Then they're saying, oh, no, you can't do that. Other people said, look, file for bankruptcy. And another person, two people said, get an itemized bill. There was a $2,000, difference in the bill. Okay, so let's see a little bit more of people who gave up having health insurance. And again, there will be a few tips near the end of the video.
Insurance premiums are set to go up 30%. Some people are reporting 50%. This is the highest increase in years. And this is if the Affordable Care Act subsidies are not renewed. That's why the Democrats are fighting so hard for 28 million Americans. If you didn't know, people who are underinsured, their job doesn't give them insurance. Maybe they're right before retiring and getting Medicare. Small businesses use it for themselves and their employees. There's people right now that are in cancer treatments, and that's their health insurance because maybe they had to leave their job. This subsidy has been around for 15 years, and Republicans have never had a plan to change it at all. And it's needed for 28 million Americans because people are already living paycheck to paycheck, and insurance is already very costly. So if somebody's paying $300 a month, and by the way, it's sliding scale based on what you make. They're paying $300 a month now. They're going to get an increase to 30%. That's $390. That's a lot. That is a lot. If it's 50%, they'll pay $450. If it's 100%, they'll pay $600. So that's why Democrats are fighting for 28 million Americans and for the Affordable Care. By the way, the Affordable Care Act also keeps your kid on your insurance until they're 26, and they are not allowed to discriminate against you for prior history. That was a big deal because insurances can turn you down. It's very important that we keep the affordable health care credits.
Everything is a scam. I had health insurance in like 6 months, and when I tell you, it's almost easier moving around with no insurance. But a huge part of it is the fact that I've been going to the same providers for years, so they know me. And so I just go in there with the jokes, be like, hey, I got no insurance. Give me the poor people discount. When I tell you, they be finding the loopholes, they be finding some workarounds. And it's crazy, because it's like, it could have been this cheap all along. But
I do not have health insurance, and I have no plan on ever getting health insurance again. I'm 52 years old, and though I've had health insurance on and off within the last 30 years, it's been mostly off. I am on no prescription drugs. I am, again, 52 years old, and I rarely even get sick. I was one of those people who would have preferred to die than get in 2021. My health is robust, and I maintain my health by taking a daily multivitamin supplement. In my case, I am vegan because that suits my body very well. And I also take nettles and uva ursi every day. I take them in capsule form, and I take at least 2 nettle caps and at least 2 uva ursi caps every day. Plus, I always take extra zinc, and usually this is anywhere from 25 to 50 milligrams of it. The reason why is zinc boosts my immunity, and it helps me to fight off a lot of colds. I'm around a lot of kids, and that means that they always have colds, and it's easy for me to catch them. But that said, I rarely get sick. I also do not have a gym membership. My forms of exercise tend to be doing either jumping jacks, push-ups, or sometimes squats. Also, I walk around in the forest. Basically, I have reconciled that if I am going to sicken and die of something, then so be it. I am not going to fight it. I am just going to let nature take its course. I really dislike the system very, very much, and that's why I will choose to just go via natural causes when it comes. So for anyone who's very scared of dropping health insurance, I don't have it. I haven't found I needed it. I had a cat bite a few years ago. I just did like a teleconference appointment with my husband's doctor, and I think he charged me $150 for the phone call, and that was it. That was my only medical event within a decade. I'm a little bit prone to UTI, so I drink dandelion tea, and I take the aforementioned uva ursi and nettles. And if I take high doses of the nettles and high doses of uva ursi and cranberry, plus my usual zinc and a little extra vitamin C, I can kick one of those straight out of my body with no antibiotics. I do believe I'm healthier because I don't see the doctor. There's that. I hope this helps someone. If you're afraid of going without insurance, obviously that's going to have to be your choice in the end as to whether you can deal with not having it. I'm just using my own example. I've not had it for a long time.
I have to tell the truth, you guys. I don't have health insurance. Somebody down in the comments is going to make fun of me or think I'm really stupid for not having health insurance, but I refuse to give America $6,000 almost a year when I haven't been to the doctor and I don't need prescriptions and I have nothing wrong with me. Insurance is literally to cover a risk. If I don't have any risky moments, I don't need insurance. And if I do have a risky moment, I'll take that risk and cover it as needed. It's probably not going to be more than $6,000 unless I crash and break all my bones.
So look, again, a lot of people are like, look, I don't want to pay these high bills. And some people are saying, look, I barely even get sick. Other people are saying, but look, you never know what can happen. What if you need surgery and it's thousands of dollars? Other people are saying, again, we'll just come up with a very low cost payment plan because this is a scam. So now let me show you some videos, about 3 or 4 videos, what people are doing who don't have health insurance, or if you don't, some tips that they're going to give you, just a little bit. Okay.
I'm a senior benefits analyst, and I want to share some resources for those who need healthcare. If you don't have insurance, or even if you do, save this video, and I'm so serious because everyone needs access to affordable healthcare. The first one is completely free Remote Area Medical, RAM. They are a nonprofit. They have pop-up clinics that offer an array of free medical, dental, and vision benefits. So pap smears, glasses, dental work, prescriptions, and much more. These are real medical professionals that are basically volunteering their time to help out the community. You can find schedule and locations at ramusa.org/schedule, and be prepared to arrive early because, as you can imagine, free resources, everyone wants to take advantage of those. And some people might even come early and camp out, but it's worth it. Community health centers offer health services to the uninsured. There are going to be copays, but they vary, and they're likely going to be low cost or income based. You can find one near you, just Google it and call to ask about pricing before actually booking. Dental hygiene schools or dental schools offer very discounted or even free cleanings, fill-ins, extractions, checkups, etc. This is a great resource. If you don't have dental insurance, I've used it myself. With Amazon Prime, One Medical gives you access to doctors and prescriptions if you don't have insurance for less than $100 a month. This is usually telehealth, but if you live in a place where they have physical locations, then you can always go in person. GoodRx also has the same kind of membership. Theirs is called Minute MD. Another option is to find out the cash amount of the service that you're trying to get, because sometimes it is cheaper to pay cash per instance instead of paying for health insurance monthly. Some doctors don't always take insurance, but they do offer a membership. So you would pay maybe $80 to $150 a month to get access to the doctor, depending on the terms that they outline. This is called direct primary care. So just look it up to find if there's any offices that offer this near you. Also, $150 a month is way cheaper than any insurance that you will find right now. Vision is usually pretty cheap, but every penny counts. Student eye institutes usually offer discounted or even free prescriptions, glasses, and optical exams. Sam's Club also has good eye exam and glasses packages. And if you already have the prescription for your glasses and you just need to order the glasses, you can get this for a discounted price on Zenni.com or Zlaw.com.
This might be common knowledge, but I have to share because I'm so impressed. If you don't have health insurance and you also have a UTI, stick around. I used GoodRx today. I have a raging UTI. I went online this morning, signed up, typed in my symptoms, got assigned a doctor, texted this doctor. Literally all I said was, hurt when I pee every hour. They said, okay, sending a prescription. That process took 10 minutes. 10 minutes from start to finish. They sent my prescription. 1 hour later, I went to Walgreens, picked it up, $7. I paid $30 to talk to the doctor. $37, no health insurance, 5-day prescription for UTI. Life-changing. Life-changing.
Here are my thoughts on GoodRx. I feel two very different emotions. First of all, I love it. It's something that I do recommend to my patients, like honestly on a daily basis, because it can bring down the cost of medications more than their insurance. For those of you who don't know, when you use a GoodRx coupon, the pharmacy is not running the medication through your insurance. You're just getting it for that cost. And it's crazy to me that that cost is often cheaper than what the cost can be through insurance, because you're cutting out the middlemen. You're cutting out the PBMs and the insurance companies. So it's great for patients, and I love that. I'll also recommend Mark Cuban's pharmacy, Cost Plus Drugs, because same sort of thing. You can see what the cost is going to be. There's transparency, and often the cost is cheaper if you were to go through their pharmacy and just pay cost than to go through your insurance. Love GoodRx, love Mark Cuban's pharmacy, but on the other side, I hate that insurance companies get away with this, because for them, when people choose to not go through their insurance and just pay cost, it's still a win for them, because now they don't have to pay for the medication at all. So they won. Also, it just kind of sucks that we pay so much for insurance, and sometimes it's better not to use it.
Okay, I'm in the car, so it might be a little loud, but I wanted to make this video just for people who don't have insurance. If you do not have insurance, if you literally need a prescription and you're like, what am I gonna do? Watch this, listen to me, write this down right now. I'm coming to you as your big sis today to just put you on. I get nothing out of this, no reward, no incentive, just to put people on and help people, because nobody told me this when I was down and out, okay? I lost my insurance almost 2 years ago, and I have been without. And when I say without, I mean I haven't had my anxiety meds, I haven't had a variety of other medications, I wasn't able to get my birth control implant out. It was just a shit show. I've had a sinus infection for 3 weeks, and I literally got fed up a couple weeks ago, and I went into urgent care and paid out of pocket. That's how desperate I was. So after that, I got fed up, and I started Googling affordable health care. I came across Boost Health Insurance. I literally signed up, like some inquiry online. You put your name, your email, all that good stuff. And someone texted me through a text. They asked me about what type of insurance I wanted. I simply responded. It took literally 30 seconds of my day. After that, he was like, can you afford $136 a month? And I said, no, I can't. I'm sorry. I have been unemployed for a while, but this is not just for people who are unemployed. I was like, no, I can't afford it. And he literally was like, great, good news, you qualify for free health care. I thought this was a scam until I went to Planned Parenthood to get my birth control out and ran the insurance, and it went through. I don't even know if I should say it out loud, because it's like, was it a mistake? I have free health care. I pay nothing. I pay $0 a month, and I'm covered until the end of 2024. Thank you, Jesus. I also get free CVS Minute Clinic Health, which means that I get 24/7 access to a provider on my phone. I literally, like I said, I had a sinus infection, and it went undiagnosed at urgent care, blah, blah, blah. I literally the other day made an appointment immediately, within 5 minutes. They were giving me a fucking prescription. 5 minutes later, I was face to face with a literal doctor who sent me a prescription to CVS. I needed a Plan B last week. TMI, sorry. But I needed a Plan B. They literally sent me a prescription. I got it for free. I went and got all re-upped on all my meds. They are free. They are literally free. I have gotten 6 prescriptions this week completely free. I have had 3 doctor's appointments where I had literal scripts sent to the pharmacy just because I needed to catch up on all my stuff after not having insurance, and it's free. It is literally crazy. Like, I'm shouting it from the fucking rooftops because this could be you. Like, if you don't have a job and you feel like, oh, there's no way I can get healthcare, you can get healthcare. That's it. That's the post.
Everybody's talking about insurance lately, but did y'all know there are other ways to get healthcare in this country other than relying on these big traditional insurance companies? That's right. Whether you want insurance, don't want insurance, can't afford insurance, there are other ways. You know I'm about to get into that. Let's go. Number one, I want to talk about the DPC. That stands for Direct Primary Care. Now, with the DPC model, you're going to have this doctor-patient relationship, and you're going to take out the middleman. You don't need nobody paying your bills for you. As a patient, you're going to select your doctor, and you're going to pay your doctor straight up. It could be a monthly payment, it could be a one-time payment, it could be a fee-for-service payment. But either way, this payment is going to fund all of your services. You're going to be seen by your physician. You're going to get your labs and your imaging. That's all going to be in that plan. And because the doctor does not have to rely on the insurance policy to determine how much your care is worth, baby, and they're not hustling and bustling trying to see so many patients, you get more time to speak to that physician. You get to have this relationship with your physician, and it's more of a tailored experience. Now, what are the cons to that? Well, the cons is if you have some kind of catastrophic event or you're hospitalized, this ain't included. If you need to see a specialist, this ain't included. I do know that there are some specialists that are moving to the DPC model, but I don't know if that's going to be in your area and in the specialty you're looking for it. But at this point, if you do DPC, you're going to have your direct primary care provider, and then you're going to have to find some other way to see your specialist. Next, the health sharing plan or the healthcare sharing plan or ministry. Usually these are groups of people who come together with the sole purpose of helping each other cover their medical bills. This could be religious or a non-religious base. But the most important thing is that it's usually flexible and at a lower cost than a lot of these insurance plans. Here's the thing though, you may have to qualify, you may have to meet some kind of criteria. Another thing is because it is pulled together by a group of people, they may or may not approve your medical cost. So the process may not be as smooth as other options, but it is an option. Next, a catastrophic plan. Now, this is an insurance plan, but it's a different type of plan, okay? Basically, you have a very high deductible, and the insurance is going to come into play when you have catastrophe. Well, this is great for people who are under the age of 30, very healthy, and they really just don't need insurance like that. They're not going to be seeing a doctor like that, so why pay for it? But if something does happen, like they do need to be hospitalized for some sort of surgery, they got coverage. They are not going to go broke because they broke their leg. Now, again, this is something to consider if you are healthy and you know you're not going to be on medications or needing doctor's visits like that. Next, a health savings account. Oh, you got to know about a health savings account. These are good if you can qualify. Now, basically what this is you're basically putting money to the side for your health. And if you have a healthcare expense, you can use it. If you don't, you save it. Now, that being said, this is a great vehicle to save money for your future. You could even trade it on the stock market, make a little extra income. But the problem is not everybody qualifies for this. You have to have met some criteria and be able to be on a high deductible insurance plan. So if you have an employer that offers this, you might want to think about it. Because instead of paying $1,000 a month for an insurance policy that you may or may not use, now you could put that money for something else, okay? And save it for down the line, or just keep saving it. That's pretty awesome. Next, alternative medicine. Okay, medicine don't always gotta be, Western medicine. There are other routes to healing. You get a massage, do some fatigue, go out there, do some Tai Chi, some acupuncture. There are so many providers out there that can help you on your path to health. So look into some of that. It could be helpful. What do you think? Do you know of any other ways that you can get by on your health without relying on insurance? Toodles.
I can't afford healthcare insurance, so what should I do? I'm Dr. Evan Levine, board certified cardiologist, and I'm here at Wash U, just outside of St. Louis for Parents Weekend. Hey guys, if you're a superb student, look for a really great learning experience, a nurturing environment. I can't imagine a better place than good old Wash U. Let's get to it. First, you need to take care of yourself. Don't tell me you can't afford health care when you're wasting money on tobacco products, alcohol, and marijuana. And make your dinners on your own. Don't go and buy them. Less expensive and healthier. So let's get to it. Number one, buy a blood pressure cuff. You can get an Omron blood pressure cuff for $35. You could share with friends. If you have a blood pressure of 120 over 80 or less, you're good. 140 over 90 or more, you need to find care. And in between, diet, exercise, and watch the salt, especially also those NSAIDs, the Motrins and Advils. P.S. Avoid the crazy people who say salt is good. Not if you have high blood pressure. Number two, go to a lab on your own, like a Quest, and get a lipid profile, CBC and CMP. It's a chemistry done. And don't go to these labs offering the most comprehensive bloods known to mankind for $400 or more. Much of those extras are what we call in New York BS. With a coupon, you can get all those bloods for $120. The problem here, of course, is what do you do with the abnormals? Normals, and you're good for a couple of years. And abnormals, depending, you may have to see a doctor. Remember, an LDL above 190 for most means you need to take medications. Over 45, get a coronary artery calcium scan. That CAC. Shop around. It's often you can get for $100 or less. The secret here is they don't only look at the calcium in your arteries, which is important to know, especially if it's over 100, but they look at other things like the heart, the size of the heart, the aorta, and the lungs. And over the years, we've seen patients with aortic aneurysms and even lung cancer. So it's important, and it's really not very costly. And finally, it's important to try to just get health care. I know it's really hard, it's very difficult, but if you have a job, try to find a job that offers you health care, okay? Very important. If you have any of these abnormalities, you might want to wait some time and then again, try to find that job with health care so you can take care of the problems you find. I hope that helps.
Did you guys hear about this? Amazon is now launching their own primary healthcare service for $9 a month. And I don't know about you, but healthcare is expensive, so I'm definitely looking into this, so let's check it out. So for the general public, people that are not Amazon Prime members, you can get it for $199 a year. And then for primary members, you can get it for $99 a year. And then just to add an additional member, you can get it for $66. Obvious question that people are going to have is what comes with this $9 a month? And so you can see here that it's 24/7 on-demand virtual care nationwide, but then also they do have offices already in place. Okay, so you can see right here that it's all the major cities, but in their coming soon, you can see that they've got major plans to expand. Another question that I would have is, what if you need medication after you talk to your teledoctor? And it looks like for an additional $5 a month, you can also get the RX Pass, which is access to generic drugs. One thing is for sure, this is going to disrupt the healthcare industry. So I'm interested, are you going to look into Amazon's healthcare?
Navigating stage 4 cancer with no insurance was no easy feat, but here are a few things that helped me. So for starters, like I said, I didn't have health insurance at the time. I was going to like a sliding scale clinic. You paid based on your income. Once I got the biopsy and knew that I was going to have treatment, I was kind of in a difficult situation because I was working for a small company that didn't have any sort of medical benefits. Once I ended up hearing from my oncologist that I really shouldn't work for the next 3 months, being unemployed actually helped me get Medicaid. Generally, getting Medicaid isn't the quickest process in the world, but since it was an emergency situation and I needed to start treatment right away, they approved it pretty quickly. I still had a good probably 1 or 2 months that went by that I didn't have any sort of coverage whatsoever, and those medical bills have completely destroyed my credit. After I had gotten the Medicaid, I also applied for SSDI, Social Security Disability, and since I was unable to work, it gave me like a monthly stipend, which helped offset some of the costs that I was incurring with my medical care. In addition, when you get Social Security Disability, I believe you also get Medicare. So I think I was double covered at one point. Hopefully that's legal. I don't know. But yeah, I mean, leading into when I finally got approved for some sort of insurance, it was a lot of just calling around, trying to find somebody who would take me on like a payment plan. It wasn't easy, but I mean, I literally just like pounded the pavement for a long time, just trying to find people who would see me. If you're navigating a diagnosis, I just want to send you a lot of love. And if you can apply for SSDI as soon as possible, I think that is a great way to get started on this process and make sure that you are super covered.
The PSA to everyone out there, get critical health insurance. When I got diagnosed with breast cancer, one of the things that I had done at my place of employment years before and didn't remember was sign up for critical health insurance. It didn't cost much. It was maybe a couple bucks every month, but I got it because you never know. And when I got my diagnosis with breast cancer, cancer was one of those things that was eligible for me to actually tap into that insurance. And so I was able to get funds that helped pay for treatment, that helped me pay for surgery, that helped me pay for anything I needed it for. There was no cap over what I could use it. If I wanted to blow it all and go on vacation, if I wanted to fix the roof on our house, if I wanted to buy a car with it, I could do whatever I wanted. But it was just one extra thing that I didn't have to worry about during a really high, stressful time in my life. So if you don't have critical health insurance, get it today.
So that is it for this video. I definitely want to know what you think. But before I go, here's an amazing company that I would like to share with you. If you want a really good smelling candle, I love candles so much, you can visit pureblazecollection.com. That's the fabulous owner at the bottom of the screen. Her candles are $18. You have vanilla cashmere as well as tranquility and other wonderful smells. I love this so much. So check out her business, pureblazecollection.com. So let me know what you think about this. How many of you are considering giving up your health insurance? Because look, the rent is high, your car payments, everything is just too much. It's too overwhelming. And you're like, F it, I'm going to put my faith in God. And if it's my time to go, it's my time to go. I'll pay out of pocket. Okay. Or again, a payment plan, bankruptcy, something, but you just can't take it anymore. And you're like, listen, these premiums going up like this is absolutely ridiculous. Okay, so let me know again, what do you think? And tell us in the comment section, how do you save on with your health insurance? What kind of plan are you under? What do you do? Let everybody know. You might help somebody out there with some really good tips, okay? Do some of you, you don't have health insurance. You said, F it, I'm not doing it. So I can't wait to read your comments in the comment section. That's it for this video. You all take care. Bye, everybody.